Hi, everyone. We'll wait for just a couple more minutes to see if more people will log on.
Morning.
Okay, there's someone named RLC3. I don't know who that is. You can let me know your full name so I can make sure that I know you attended. Hi, Bo.
Hi,
Lucy.
Hi.
Great. I'm glad you guys can hear me.
Yeah.
Hello. Hi.
This is Robin Cleary from Mass General.
Oh, hi, Robin. You're able to make it?
Yes, things worked out.
Yay. That's great. And it was also okay, like you said in the email, you're familiar with the EDIC and DPPOS, and it's pretty much the same materials. There's obviously a couple of slides specific to the PERL study, so glad you can make it.
Great, thanks.
Okay, so I have Robin on the line. Can you, let's see who else. There's Amanda and Bridget. I think, and I saw Jamie. There's a couple of other people with phone numbers. I'm not sure if that's, actually, I don't know who that is. And then there's RLC3.
That's me.
Okay, that's you. Okay, got it.
And Shannon Stum.
Okay, hi, Shannon.
Hi.
So we got Shannon, Bridget, and okay, just one more minute. I want to make sure that I have everyone online. Okay, yeah, looks like everyone's here. Okay, great. Okay, so I'm going to pull up the slides. Okay, everyone, let's get started. Thank you so much for attending the PERL Skeletal Health DXA Tech training call. My name is Caroline. I'm the QA manager, and our responsibilities is setting up everyone, making sure that each DXA Tech is certified. If you have any questions in regards to the MOP or the quick reference guide, you can ask me. And then Bo Fan, she will be the person reviewing and analyzing the participant scans. So if you have any questions on scan acquisition, she's the person to contact. And then we also have Lucy Wu on the line, who is the project director for the PERL study. Okay, so a quick overview. We'll be obtaining DXA scans of the hip, spine, and forearm at baseline. What will the DXA QA Center do? We'll provide an operations manual. I did email that last week with the quick reference guide, so if you didn't receive it, let me know and I can forward it to you. We'll provide training, DXA Tech certification, and technical support throughout the study. And as of now, looks like we received everyone's certification scans as well as their DXA license, ISCD certification or manufacturer training. So I appreciate everyone sending the documents to me. We'll analyze scans and keep essential archive. We'll assess the scan acquisition and make recommendations to improve on positioning. We may suggest to rescan the participant if the scan is unacceptable. We'll help monitor longitudinal scanner performance, and we'll organize a cross-calibration of each scanner. So at the beginning of the study, we'll send a set of phantoms to you. You'll scan those phantoms. You'll upload them to our RAE UCSF secure platform. And then we'll review them, make sure that the scans look okay, and then you'll ship it back. Well, actually, we'll ship it back and move it on to the next PERL clinic. Key site responsibilities. So each site must identify a lead tech who will be the primary contact for the study. You must read and understand the PERL SH MOP, the Hologic User's Guide, and be certified by us to acquire scans. And each site is also responsible for scanner maintenance. Participant scanning. So this is just a short description of what the study coordinator will do. So they make the DXA appointment. For women, they should verify that the participant isn't pregnant, and the type of verification will vary by institution. And then they'll complete a section on the DXA transmitter form, which will have the biographical information for you to enter in the Hologic software. You should have this form before scanning the participant. So here's how the forms look like. The section that the study coordinator will complete is the gray box, which is section A. And then section B is completed by you, which is the rest of the questions on the form. Now, if the height and weight is not filled in by the study coordinator, you will have to measure the participant's weight and height and record it on the form. So this is just this little section right here at the bottom of the gray box. Then the completed form is sent back to the study coordinator along with printouts of the spine and hip reports. Okay, so you're familiar with the Hologic scan biography. The only two fields that I want to note is the ethnicity and the date of birth. So on the transmittal form, if the participant identifies their race and ethnicity as other, just enter white in biography. And then under date of birth, for each participant, enter January for the month and 1 for the day. And then for the year of birth, enter in the real participant's birth year. Okay, moving on to participant eligibility and preparation. So again, for women, you want to check the DXA transmittal form for the question on reproductive potential. If it's marked yes, then you want to verify that before scanning. So depending on your institution, some require negative urine pregnancy tests on the same day, and others may accept a verbal report from the patient. Verify that the participant was not involved in any studies with barium or radioisotopes 1 week before the DXA scan. And if the participant has taken a supplement, you can continue with the scan, but you want to note it on the scan log if the tablet is visible. Instruct the patient to change into a gown without snaps. Ask to remove all clothing except underwear and bra. If there's metal in bras, such as an underwire bra, please have them remove it. And then check that there's no metal or plastic objects in the scanning area. Exceptions would be an insulin pump and CGM, which we'll talk about in the next couple of slides. And then remove any jewelry that will show in the scan field. It is okay to leave rings and earrings on. Okay, moving on to specific preparation for type 1 diabetes. So you want to ask the participants if they would like to check their blood sugar. And you want to allow time for this prior to scanning. This is just to ensure that hypoglycemia does not occur during the scan. Participants with type 1 diabetes may be wearing an insulin pump or a CGM, which is a continuous glucose monitor. Okay, an insulin pump is a traditional pump that includes a small box containing controls. The pump is connected to the infusion set by tubing. This box should not be exposed to the x-rays of the DXA scans, so please have the participant detach the pump prior to scanning. The infusion set stays on and it's not removed. Okay, another form of insulin pump is a patch pump. They're directly attached to the skin. They won't be harmed by x-rays, so it should be left in place for the DXA scans. Okay, the continuous glucose monitor, also known as CGM. It includes a sensor transmitter unit that's attached to the body and a small wireless monitor that's carried in a pocket or clipped to the waist. The wireless monitor should not be worn during the DXA scans. The sensor transmitter unit can be left in place during the scans. However, we don't know the effects of x-ray exposure. If you want participants, we should verify the performance before and after the DXA scans to make sure that it's reading the blood sugar levels accurately. Okay, so if the insulin pump infusion set, patch pump, and or the sensor transmitter of the CGM is in the scan field for the left hip, scan the right side instead. Okay, moving on to acquisition. So for hip, scan the left, unless hardware prevents, scan the right. For scan mode, use the fast array. Adjust the rotation of the femoral shaft by holding the ankle and knee joint. Shaft should be parallel with the long axis of the scanner. And then firmly strap the foot to the Hologic hip positioner. If you need to, stop the scan to adjust the abduction, adduction of the femoral shaft. Okay, so here's an image of a properly acquired and analyzed hip scan. So the femur is straight and rotated properly, and you can tell by the lesser trochanter, it's barely visible. And then at the greater trochanter, there's no excess bone at the top. It's also nicely centered. For the analysis, the neck box should be anchored right at the inflection of the greater trochanter, and the rest of the sides should be in soft tissue. Okay, moving on to spine scan. Again, use fast array for the scan mode. You want to center and check the patient's alignment on the table. By doing so, using the Hologic block to aid in positioning. The spine should be imaged in the middle of the ROI, and a bit of the iliac crest should be visible at the bottom of the scan. You'll be scanning L1 through L4. If scan is not imaged properly, abort, reposition, and start the scan again. Okay, so here's an image of a properly acquired and analyzed spine scan. So you can see that the first set of ribs is visible at the top, and a bit of the iliac crest is visible at the bottom. Nice and straight in the scan window, and it shows L1 through L4 clearly in the scan. Okay, moving on to forearm. So scan the non-dominant forearm. If that forearm is fractured or contains hardware or metal, scan the other forearm. This time use array for the scan mode. Make sure the participant's head is clear from the scanner arm. The participant should be made as comfortably as possible to reduce the chances of motion. And then you want to measure the distance from the ulnar styloid to the table in centimeters and record it on the participant's scan log. As you know, we do need this information in order to analyze the forearm scan in the Hologic software. Okay, so here's an image of a properly acquired and analyzed forearm scan. One thing to note is just this nice and centered in the scan window. Okay, moving on to scan analysis. So for the scans, just use your clinic's standard analysis procedure. You will provide a report of the hip and spine to the study coordinator. For the forearm, you do not need to provide this to the study coordinator. Okay, reports to participants. So you can let the participants know that their hip and spine DXA scan results will be given to them by the study coordinator. Okay, scanner maintenance by the DXA tech. So scan the Hologic spine phantom every day as subject to scan, but at least 3 times per week. Make sure you check your plots, the BMD, BMC, and area to ensure that it's in acceptable range. And make sure you schedule your preventive maintenance with Hologic. And then let us know if you had any preventive maintenance done or any other service done on your scanner. Send us the copy of the file. Send us a copy of the service report. Okay, so electronic scan transfer. So you will be uploading DXA scans and files to our UCSF secure platform called Research Analysis Environment. So I will give everyone access to this platform, and you will receive a UCSF IT email with instructions on how to register. It's pretty simple once you log in. You know, there's I did provide instructions on how to upload in the appendix in the MOP. So on a weekly basis, participant scans should be uploaded to us along with the completed scan log. And then at the beginning of each month, you'll send your spine phantom scans and the PDF of your QC plots. We would like for you to plot at least 1 year of data. And if you had any services done in the previous month, send a copy of the service report. Okay, so just a quick question. In the past, we've had sites that are that were unable to upload scans to us due to their institution. So if you know as of now that you won't be able to upload scans to us, let me know. There's other ways to get the DXA scans to us. Okay, moving on to forms. So as I've mentioned in the previous slides, the transmittal form. So you will receive this from the study coordinator for each participant. And the information from section A will be entered in the Hologic biography. And you'll complete your portion, which is section B, and return it to the study coordinator, again, with printouts of the hip and spine. As for the participant scan log, so you enter information for every scan that's acquired, and you'll send this with your participant scans on a weekly basis. Okay, so here's a clear view of the transmittal form. Again, section A is filled out by the study coordinator, and then section B will be filled out by you. And then again, if this is not complete, you will have to measure the weight and height for the participant and enter that in here. So I'll just quickly go through the questions. Section B, so date of visit, you'll write that down here. Question 2 is the eligibility question. So if they are eligible to continue, move on to question 3, and that's if the participant was wearing an insulin pump or a CGM. Question 4 is if you did perform the scans, which one did you perform? If they were completed or not completed. If they weren't, check any of the reasons here, and then you can leave your additional comments here on the far right. Question 5 is once you transmit the scans and the scans and scan logs to us, you'll just write in your date of when you uploaded the data to us. The last one, question 6, is just a comment of any further problems, eligibility, protocol, collection, and transmission. Check any boxes that apply. Any additional comments you can write here. Okay, participant scan log. So this is pretty simple. You just write the date of the visit, participant ID, initials, circle in the scan type. You'll write the Hologic scan ID for each scan. If there's a scan that needs to be flagged, check that box and write in your reason here. Now for every forearm, again, make sure you enter in the length. Okay, so this is the end of the slide. So if you have any questions, please let us know. Again, we're here to help you. As I mentioned at the beginning of this slides. If you have any questions about the MOP, the QRG certification, feel free to contact me. And then for Bo, have any questions about analysis or obtaining scans, you can contact her. So now here, if you have any questions, let me know. Does anyone have any questions about the study?
When do you anticipate the first patients being scheduled?
That might be a question for Lucy.
Okay.
Lucy, do you know?
Depending on your site's IRB approval, I would say earliest would be like late April.
Okay.
Yeah.
Great.
Okay, does anyone else have any questions? So we're best reached through via email. So if you prefer to talk, we can definitely choose a day and time to talk over the phone. Other than that, thank you so much for attending the call. I did want to note that this was the last certification requirement. So in the upcoming weeks, I will be providing a DXA Tech ID for each of the DXA Tech. All right, well, that's it. Thank you so much for attending. Welcome to the PERL study. And I hope we can help you with anything that you need, okay?
Thank you.
Thank you.
Bye-bye.
Bye.